they do medical journal writing. So every time they are in a medical institution of any sort for rotations, they have to write about it. And would they do that completely in confidentiality, and they're talking about their experiences, and that's something that a lot of them reflect back on. And then we go back over, what did you learn today, and it's amazing what they come back with, and it's stuff we can't teach here in the classroom, so we rely very heavily for it to be taught out into the clinical settings. So you may encounter a patient who's on the floor or in the ER that has to come into the radiology area in X-ray for an X-ray of whatever it could be. And X-rays usually show us what? When we're looking for an X-ray, what part of the body are we really looking at? The bones. We're looking at the bones. Could they be sending a person in for a chest X-ray? Have you seen anybody come in for a chest X-ray yet? You have seen somebody come in for a chest X-ray. He just said that he was having difficulty in breathing. Okay, can any of you think, with what you know, why you would have a 4-year-old boy having difficulty in breathing that would require a chest X-ray? Asthma. Asthma, or what's another one that's related to the asthma? Bronchitis, pneumonia. In talking to the instructors, again, because I see them out in the clinical sites, our students who have gone into the nursing program or the RadTech program or the respiratory therapy program at Allen Valley College, they always comment on your students are so much more prepared. And because we have exposed them, and they may not be the highest end child of any sort, but they're prepared for that medical environment. And they're always commenting on, I just love having our students come through our program.
Yeah, we learn vital signs, we learn CPR, we learn all of our medical terms and things like that. So if a healthcare provider comes to us saying these things, we'll know what it is instead of be like, I don't know that. Okay, now cry is a very good clinical assessment. Was that a loud cry? Was it a weak cry? It was a loud cry. Was it an intermittent cry, like or was it ah? Because he's moving some good what? When you can go you got some good what? You got some good air going through there. If you're going that's a little short air. We're having some difficulty in getting some air going through there, right? Okay, so that is a very good clinical sign.
And even if they don't go into medicine, we still feel like we were successful because we put those foundational skills and work ethics into them. And I think that's something that a lot of places don't have. And so our students are always, can I use you as a reference? Of course you can, but we're going to tell the truth. And they're like, okay, that's okay. So I think that we do have a lot that do go into that way. And if they can get 2 different types of things, of as far as like a healthcare provider position or a customer service position, and they get into teaching, we've got a couple subs now that are teachers or former students, so we're tapping into them as much as we can. But I think that is one of the areas that they do find they go into is they like the teaching, and they always call us their mentors.
So you have to definitely be able to communicate with people, and you have to be able to write things down, especially in my profession. Have to be able to articulate and write everything as clearly as possible. Documentation is very important in my field, especially with liability and things that are involved with that. So English is definitely a very big deal.
All right, information to obtain. So we've already kind of talked about how you're going to have difficulties in obtaining some of this information. You have one day. And you guys know with the situations you are sometimes at the hospital, you got a lot of time to be there with the healthcare provider and ask questions, and then you have time when you do not. Remember, some of you are at Allen Valley Hospital, which is a major trauma center. And there's a lot of stuff that could be happening at any type of area of where they're at.
Especially with the Health Careers Academy, they really implement medical terminology early on, and so that made it a lot easier to transition into nursing school because I was already familiar with the terminology there.
Hypo or hyper? What's hypo? Hypoglycemic is, and hyper is. Okay, so which do you want to have? Because they're different. Hypoglycemic? Hypoglycemia. Okay, so that means a low what? Blood sugar. Low blood sugar.
Starting as a 9th grader, the students are able to sit for the American Heart Association CPR exam. Then as a junior, they sit for the American Heart Association Basic Life Support Healthcare Provider exam. And then as a senior, they can sit for the National Registry EMT exam, become certified EMTs, and then they can also sit for the CMA or the Certifying Medical Assisting exam.
Well, I'm now certified in CPR and first aid, so I'm pretty fluent in doing CPR. I could get it done, and we'll get our certification in first aid, emergency first aid, working on that too.
As far as math, definitely have to, include that in our practice. The pharmacist is the one who deals with the medications, but as a nurse, you have to be able to, notice when there's a medication error, if the dosage isn't right based on the patient's weight. So you have to definitely, be aware of, the math that you're doing so that you don't cause a medication error and, affect the patient in the long run.
To quote one of the students, former student that received a full ride to Princeton, who grew up in a single family situation here in Palmdale with violence and many other aspects against her. She had never left the Palmdale area or the LA area, and then she went off to Princeton, and I asked her, what was it like going to Princeton for your first time? She made something made a comment I'll never forget, and that is, while I was here in the academy, I had the opportunity to interact with healthcare providers such as medical doctors, such as nurses, very high-end professionals, and it doesn't matter what community I was in, I was able to interact with these high-end professionals, giving me the confidence to succeed while here in this foreign place.